Okay, well, morning everybody. My name's Chris McCarthy. I'm a consultant physio and the clinical lead for the Manchester Movement Unit, which is the clinical department in the Brooks building, which is predominantly a physiotherapy practice, but we're lucky enough to have some expert clinicians who are not physiotherapists, including Phil Trubshaw, who's on this call and will be speaking in a few minutes' time. And this little presentation is for Mental Health Awareness Day this year, and you can tell it's about some of the treatments and methods of managing mental health that we can offer in the university, but particularly here at the unit. So the unit, like everyone, has had to adapt in the pandemic, and so we are able to offer video appointments for those who don't want to come in, but we are open face-to-face with the appropriate infection and prevention and control measures, including aprons and gowns and gloves and temperature checks, and all our staff have had the first of two vaccines within the vaccination program, so it's quite a safe environment should you feel confident to come in to the unit. And as I mentioned, we're predominantly a physio practice offering treatments for preventing and rehabilitating musculoskeletal and neurological problems. But we have an expert, what I call a proper acupuncturist, working with us, Phil, who you'll meet later. And we also offer therapeutic massage currently in this climate for the treatment of painful conditions. And in standard days when there isn't a pandemic, then we offer sports massage for athletes, pre and post events, etc. And you may have seen us already on YouTube, as we have one of our sports massage therapists is a yoga instructor and has been posting really helpful yoga videos recently. But you may be aware, as you're watching this presentation, that mental illness is a really prevalent problem in society, with 20% of working age women and 17% of working age men being affected by depression or anxiety. And I don't have the evidence, but I would be very surprised if it isn't higher than that in the last year, with everything that we're all surviving through. But it accounts for more disability in adjusted life years, so in terms of the cost, than any other health condition, although back pain is a close second to mental health issues. But there is a very strong link between physical activity and the benefits of physical activity and mental health. So physical activity has been shown to offer both preventative and therapeutic benefits for mental health conditions, improving mood and cognitive function, improving self-esteem, also improving sleep and reducing stress, and is recommended in the NICE guidelines. So for people with mild to moderate depression, physical activity is one of the core recommendations within our national guidelines for the management of that condition. But you can see that does involve quite a lot of intervention, so 2 or 3 sessions a week for 10 to 14 weeks. And in the current climate, I do wonder how much of that is actually provided in our NHS services. But the aims of exercise with people with depression is to reduce negative feelings associated with lack of mobility and improve self-esteem, setting goals and developing mastery of movement, which is very helpful. And within a number of trials, this has been shown to be effective, and we need to roll this out so that GPs are more aware of it and that there are more services being provided, because it's certainly a very cost-effective way of managing mental health issues, and particularly depression and anxiety. But exercise and physical activity, really, without waving the being too evangelical about it, is recommended very strongly by the Chief Medical Officer. And you'll have seen this, the kind of recommendations in terms of doing 150 minutes of moderate exercise or 75 minutes of vigorous exercise, or combinations of both each week. And if you're over a certain age, then balance exercises are important. But the bit I think that tends to get a bit lost in this is that actually muscle strengthening exercise is recommended within that week, twice a week. So that means the typical kind of weight training kind of exercise is also to be included within your physical activity kind of dose per week. But again, to really just hammer home the advantages of physical activity, if you look at something that actually has good evidence for reducing the risk of developing cardiovascular disease, a host of musculoskeletal conditions, including back pain, a host of mental health conditions, including depression, and also reducing the risk of cancer and metabolic diseases like diabetes and obesity, then if you're looking for the, the panacea, well, it really is physical activity. And you can see we're not talking about small reductions in risk here for things like cancer. You've got a 30 to 50% reduction in risk, 20 to 30% reduction in Alzheimer's, a 20 to 30% reduction in depression. So if there's one thing that we ought to really consider in our lives, it's incorporating physical activity. But also, if you have cancer or diabetes, or if you have cardiovascular disease or osteoarthritis or back pain or depression or anxiety, then these are just some of the conditions that have been shown to benefit from physical activity. And again, this is very strong evidence. So I hope that's convincing for you to consider it within your week. And one of the big barriers to, I don't like the idea of running, for example, is the worry that has been perpetuated in the medical profession for some years, that there is some risk to developing knee arthritis with running. And this is just one of a number of recent studies that have shown that actually moderate amounts of running are actually preventative for knee osteoarthritis and certainly don't increase your risk of developing knee arthritis. So just to throw that in there. And the other feature of us as people is that there needs to be a recognition that people who have chronic pain are much more likely to have mental health issues, including depression and anxiety. They're 4 times more likely. And if you look at our population in Greater Manchester, within 10 years, it's felt that a third of the population will have some chronic pain element to their life. And therefore associated with that will be high degrees of depression and anxiety. So reducing pain has been really strongly linked to helping with mental health issues. Pain isn't simply something that's local to the tissues that may be painful. It has a huge impact on the body as a system, and particularly when it's long-term pain, has a strong influence on what's called the hypothalamus pituitary adrenal system, or the HPA system, which is moderated by your autonomic nervous system, and particularly the sympathetic nervous system. And if you've had chronic pain for a long time, this axis is completely upset, and people tip into being chronically sympathetically overactive. So they're in a fight or flight system all the time, which has been linked with conditions like anorexia, for example, because you're continually in that fight or flight system, as opposed to the sort of rest and recovery parasympathetic system. You'll be familiar with the sympathetic nervous system, this side of the balance. It's the fight or flight response to threat, as opposed to the parasympathetic side of the system, which is controlled by the vagal nerve predominantly, which is the rest and recovery side of our nervous systems. And with chronic pain, with a lot of mental health conditions, people are very over-sympathetically stimulated, and you can see that will have influences on glucose levels, and lung function and heart function, and a whole host of autonomic functions within the body. So reducing pain, improving physical activity are really helpful in improving general health and mental health. But of course, telling somebody who's in pain, right, go and move, that in itself is a strong barrier to physical activity and improvement. If you're anxious about the pain that movement causes, then you're less likely to move. And so that's where rehabilitation comes into picture in terms of being able to help people to move by reducing pain. So there are various modalities that physios use. So, you'll be familiar with the ice and the TENS machines, and then we also do stretching and mobilization and taping and bracing and then strengthening and balance work and stretching and so on. All of these things you kind of probably come across, but they have to be prescribed in appropriate order and in appropriate amounts to allow reduction in pain and therefore facilitation of movement. And within that remit, of course, in addition to what we offer for pain relief and the management of mental health, there is also acupuncture, which Phil will talk more about in a minute. So it's worth recognising that we all have obstacles to physical activity, and that's often in these kind of categories. So it's a lack of time. There's influences from the social environment about whether you should exercise or shouldn't, barriers that are in place from that. There's lack of motivation and lack of resources, and there's a couple of strategies there for you to review if you think, right, well, how can I address these so that I can become more physically active to address my physical and mental health. But a really nice example of how you can do that is there's a similar map to this for the London Underground. But what this shows you is the number of calories it would take if you, say, got off the tram at stop early from your stop and walked that distance. You can see it's just an idea, these small incremental changes that can increase physical activity, and these are kind of incentives to begin a behaviour change that improves your physical activity and therefore your mental health. Within the unit, we have a large cohort of women who have either antenatal issues or some gynecological issues that cause pain and discomfort and dysfunction, and lead to a degree of anxiety and stress. And we have a women's health specialist in the unit who can help with those particular issues. And as I mentioned, we have an expert in the field of acupuncture working with us. And I think, Phil, now, if you wouldn't mind unmuting and coming in and tell me when you want the slides to move, I'll move the slides on, Phil.
Hi everyone, my name's Phil. I'm an acupuncturist and Chinese medical herbalist, and I've been in practice since 2011. I've had special interest in martial arts, and with that some sports injuries, but also in mental health as well. I recently completed my MSc dissertation in the psychopharmacology of a group of herbs which work on the mind. And acupuncture and Chinese herbal medicine come from the same systematic understanding. Originates traditionally from a theory from ancient China about 2,000 years ago. And one of the things that we work as a profession now is how we develop and grow that over the times into a current clinical understanding used in research. If you could move the slide along there, Chris. Mm-hmm. So we have acupuncture, which is the insertion of small fine needles at specific points around the body. And what we essentially will try to do is understand each person's particular presentation of their illness, whether it's pain from an emotional point of view or from a physical point of view, how this ties together into a group of patterns. And these patterns will then express themselves in certain signs of symptoms. And so we will select specific points around the body, which enables healing and improvement of the physical and mental signs. We use more hands-on methods. So acupressure is something which we can prescribe to show people at home. So there's certain points that we can use, like in between the eyes here, that can be quite sedating and calming to help someone get off to sleep. Or there's other points we can use on the body, on the wrists, which can be used to help calm panic attacks, things like that. These will usually be prescribed at a time where, during an acupuncture session, for example, when we look at acupuncture in a modern research setting, over the past 20 years, there's been about 13,000 studies done on acupuncture. And now there are in the region of 115 to 120 different conditions which acupuncture has been shown in research to be effective for. And some of those areas that are increasingly developing are within anxiety and depression. And there's some other conditions which are more severe that there's some ongoing research into as well. And some of the mechanisms that we start to see happening through acupuncture treatment are fairly similar to what happens with physio. So a lot of what you can see happen when a person is experiencing a treatment is a relaxation response. And this is fairly similar to what you might experience in meditation or yoga, or the experience following a period of exercise where your body suddenly goes into a relaxation mode. And this is really helpful for people who are experiencing troubles with their mental health. So a lot of the time there's a lot of stress and triggers more. It's a bit of a cascade effect. And so we find that in acupuncture research, the central nervous system can be activated and then calm down, which then enables for the mind to relax. Mental health problems tend to improve. And at the same time, and this is where acupuncture can be quite unique, is that we can treat the mental side and the physical side as well. So via the treatment of physical pain, we can improve mental health, and by the improvement of mental health, we can improve physical pain as well. Yeah. So the World Health Organization over recent years have begun to recognize acupuncture and Chinese medicine as being a valid treatment approach, and has encouraged over the past few years for acupuncture to be integrated within mainstream care. There's a few conditions that acupuncture is now available and recommended for the NICE guidelines, such as migraines, headaches, osteoarthritis of the knee, some shoulder pains as well. And progressively, we're trying to increase the research and evidence base to get more of those into mainstream healthcare as well.
Lovely, thanks, Phil.
Welcome.
And just to round things up, let's not forget the wonderful power of touch to relieve anxiety, depression, and other mental health issues. And this, again, from a physiotherapy point of view, there's quite strong evidence that there are large impacts on some of the pain relieving and happy neurotransmitters that are released in the brain in response to particular stimulus. And certainly massage stimulus has been shown to be useful in terms of relieving stress and relieving pain, and that's another modality that can be offered here at the Manchester Movement Unit. So I hope that gives you some kind of flavour of some of the things that are on offer in the Brooks building within the university, with opportunities to visit us with student placements, which are heavily subsidised. If you're a member of staff, then the fees are subsidised. If you're a local resident, then fees are subsidised. So lots of opportunities to come and discuss physical and mental health issues with the practitioners here at the Manchester Movement Unit. And we hope this has been helpful and useful on today, Mental Health Awareness Day 2001.